I sent a letter to Johnson & Johnson requesting partnership to directly purchase 300,000 doses of the vaccine manufactured here in Baltimore to help ensure equitable vaccine distribution to our residents. We know that to effectively combat COVID-19, we need a greater supply of vaccine and a focus on equity. We must develop a model for distribution focus on efficient and accessible vaccination strategies that put equity and harm reduction at the forefront of policy and planning operations. Due to inadequate supply, we know we are struggling to distribute the vaccine to our residents in a swift and equitable way that we must do it in order to combat this deadly virus. To date, nearly 44,000 first doses have been administered by a combination of the Baltimore City Health Department and our 11 hospital partners here in Baltimore. But unfortunately, due to prioritization dictated to us by the state and the extraordinary low supply of vaccines supplied to the city, only 3.4% of black residents have received their first dose of the vaccine, and that's just simply unacceptable. Of those doses that have been delivered by healthcare providers in Baltimore, less than 20% have been distributed to the city's health department, giving the city a very limited ability to improve this disparities. I want to thank our health department and all of the people working tirelessly to ensure Baltimore residents are vaccinated as quickly as our supply allows. But we see in these numbers what is needed. What is needed is the supply. I want to thank Johnson & Johnson for selecting Emergent Biosolutions to manufacture the life-saving vaccine here in Baltimore City. Emergent is and remains a strong partner to the city of Baltimore, and we are proud of its role in fighting this pandemic. I believe that through this proposed partnership, Johnson & Johnson and Baltimore City can show a commitment to equity and efficiency in vaccine distribution in a way that is unprecedented across the U.S. We have the opportunity here to focus on equity by ensuring distribution to black and brown communities that have been historically underserved by Big Pharma. And with that, we'll take a few questions.
Good afternoon, Mayor Scott. I just have a quick question about the Johnson & Johnson proposal. I'm just curious if you've had previous conversations with Johnson & Johnson that would sort of indicate a partnership like that is likely to take place. Obviously, I'm sure there have been prior conversations about emergent biosolutions and stuff like that, but wanted to ask about any prior
No,
conversations.
this is about doing what's right and what's needed for the city, and we're just very hopeful that Johnson & Johnson will realize what where we are right now and where we are as a country, as a city, and do something that will benefit a city in which they are producing their vaccine. Thank you. Alexa?
Quick follow-up to that. How confident are you that that could happen? What's the likelihood? Do you think it could happen?
Well, we don't know, Alexa, but this is you miss 100% of the shots you don't take. This is about doing what's right for the residents of Baltimore City, and this is why we decided to do that. And what we're hopeful for, and we know that there's other barriers that we will have to cross. We'll be talking to our federal partners about those. What we're hopeful is that Johnson & Johnson will recognize that they are making this vaccine here in Baltimore, and it would be a shame if the Baltimoreans didn't directly benefit from it.
Can I get a comment for you on the officer who was in field training, now facing assault charges? How will the city continue to build public trust following an incident like that?
Well, again, I think let me first thank the police commissioner and his team for immediately moving to have that officer or probationary officer terminated. It goes to show that you heard that from us. Typically, you guys in the past, you will be bringing that to us saying, oh, this happened this weekend. No, we told you that this person was removed because that's how you build trust, through transparency, through swift action. We're going to continue to make sure that we're reforming our department through the consent decree, through the efforts that we have going on in Annapolis, and we're going to build trust by working directly with the community and taking action when we see things like this.
Thank you.
Well,
Mr. Mayor, given the issue with supply and now with this rollout, what would you tell citizens who are having trouble getting appointments? The health department appointments are booked. What advice do you have to them? There's a lot of confusion as to do I wait for a van to come to my neighborhood? What would you tell the citizens who are still waiting?
Yeah, first thing is to be patient and that we're still fighting. I was on a call today, and also just to be very clear that this is not just a Baltimore City issue. I was on a call today with county leaders from the Eastern Shore and Southern Maryland who all were complaining about the same exact thing, the state's rollout and how they're doing the vaccine. A gentleman, one of our elected leaders from one of the counties in the Eastern Shore, said that Walmart has gotten most of theirs, and many of them are going to people from Delaware. That let everyone know that we are going to continue to push both here, partnership with our state, but also understanding that we have a functional president now. President Biden believes that COVID-19 is real, that he's going to make sure the federal government is pushing these things out, that we're going to be ready here with our partners on the ground to get it out to people as soon as we get it.
To that point, should citizens sign up for a waiting list, or I know there's a place where you can fill out on the health department website?
Yeah, I'll let Dr. Gerarza give the explanation of exactly what folks should do, especially our older adults, the folks who are most at risk, about where we are and taking the number and how we will get in contact with them.
Yeah, so specifically as it relates to older adults, we expanded something called our Maryland Access Point, which is a call-in line for older adults who either are challenged to navigate the online registration system or just don't have support to navigate it. They can actually call in and pre-register. They can be put on a waiting list for a vaccine appointment. We've been given directives at the local health department to prioritize older adults, homeless, as well as educators. And so that's generally where our focus has been. Just a reminder that this month, for the month of February, our current vaccine pod is only doing second doses. But again, individuals can call into that MAP call line, 410-396-2273, if they're older than 65 and need support pre-registering for a vaccine.
In relation to the 50 to 100 vaccinations by this mobile unit, can you talk about the allotment? How much do you have kind of on hand, and how is that either being divvied out, or how are you selecting these nursing homes that you spoke of during the presser?
Can you say your question for me one more time? I heard bits and pieces.
Sure. With the 50 to 100 vaccinations, how much does this mobile unit have in stock right now currently?
Yeah, so again, we get notified of our allocation from the state sometimes a few days before we actually get it. And so we're making decisions internally based on that prioritization that I mentioned, specifically older adults, in this case with the focus on senior housing sites. And then based on what we've been notified we're getting from the state, then we're able to allocate to our partners to perform those vaccinations. Again, typically it's been about 50 to 100. Obviously, we hope to see that number go up as actual quantity goes up, but it will vary from week to week based on what our allocation from the state is.
So there's no number though, because I know you mentioned that you're going to 2 this coming week, correct? Do you know how many doses you have?
So for those individual sites?
Yes.
So we'll give 100 for those individual sites as well.
And then in relation to the nursing homes, how are you selecting these that you're going to at the mobile unit? Have they already been pre-screened?
So again, our nursing homes were part of the Federal Pharmacy Partnership, but we know that even when the Federal Pharmacy Partnership came in, they didn't necessarily vaccinate every single resident of the nursing home or every single staff member. So we're going back through that list to understand who may still be unvaccinated, and we're going to select based on who is still outstanding and has not yet been vaccinated through that partnership.
While also taking into, I'm guessing, because you said equitability, their race and their neighborhoods?
Yep.
Thank you, Lowell.
Just real quick, just had a question about outreach. I know in past news conferences you've mentioned that there has been some trust issue with the vaccine in a number of the neighborhoods that you're targeting. Will these mobile units and the staff that will be there, will they help in this effort for the outreach to get people to trust the process?
Well, I think this is a part of it, but you'll hear from us very, very quickly in the next few days about how we're going to roll out even more, build more trust building. I know that that's something we're going to continue to do. Again, this is about not just when you're talking about building trust for folks who may have vaccine hesitancy, it's greater than our health partners, right? They're doing their portion. They're going to help with that. They continue to do that. But we'll be partnering the health department of the city about targeting and working with credible messengers to get in the community to make sure that we're getting a message out from every standpoint.
Thanks.
Thank you, everybody.